This happens because either a significant portion of the small intestine is missing or it's not functioning properly. The small intestine is where most of our digestion and nutrient absorption takes place. Short bowel syndrome, or SBS, is a condition where the small intestine isn't able to absorb enough nutrients from food. This happens because either a significant portion of the small intestine is missing or it's not functioning properly. The small intestine is where most of our digestion and nutrient absorption takes place. When it's compromised, the body struggles to get the necessary vitamins, minerals, and calories it needs. Various factors can lead to SBS, including congenital defects, surgical removal, or injuries. The extent of the remaining functional small intestine plays a significant role in the severity of SBS symptoms. Some may need dietary changes, while others require intensive medical interventions. It's essential for individuals with SBS to work closely with their healthcare team for effective management. The signs and symptoms of SBS can vary, depending on the severity of the condition and the specific nutrients the body isn't absorbing effectively. Common symptoms include diarrhea, which can range from mild to severe and watery, often leading to dehydration. Another common symptom is abdominal cramping and pain, caused by the rapid transit of food and malabsorption of nutrients. Bloating and gas are also frequently experienced due to the fermentation of undigested food in the intestines. Weight loss is a significant concern for individuals with SBS as the body struggles to absorb enough calories and nutrients. This can lead to fatigue, weakness, and an overall decline in energy levels. Malnutrition can compromise the immune system, making individuals more susceptible to infections. Long-term complications of untreated SBS can include kidney stones, gallstones, and liver dysfunction. Dietary adjustments are a cornerstone of managing SBS. The goal is to maximize nutrient absorption and minimize symptoms. A registered dietitian can develop a personalized meal plan tailored to the individual's specific needs and tolerances. This plan often involves eating smaller, more frequent meals throughout the day. Certain foods may need to be limited or avoided, such as high-fiber foods, fatty foods, and lactose-containing products. Focusing on easily digestible foods, such as lean proteins, cooked vegetables, and fruits without skins can be beneficial. Supplementation often plays a vital role in managing SBS, helping to replenish essential vitamins and minerals. Staying hydrated is paramount, as frequent diarrhea can lead to significant fluid loss. Drinking plenty of water, electrolyte solutions, or clear broth throughout the day helps maintain proper hydration. Medical interventions may be necessary, particularly in cases of severe SBS. These interventions can include medications to control diarrhea, reduce gastric acid secretion, and manage pain. Parenteral nutrition, also known as intravenous nutrition, may be required for individuals who are unable to absorb sufficient nutrients through the digestive system. This involves delivering essential nutrients directly into the bloodstream through a catheter. Intestinal transplantation is a complex surgical procedure that may be considered in select cases of severe SBS where other treatments have failed. This involves replacing the damaged or missing portion of the small intestine with a healthy donor intestine. Growth hormone therapy may be used in children with SBS to promote intestinal adaptation and improve nutrient absorption. Regular monitoring and careful management are essential to optimize outcomes. These medical interventions can significantly improve the quality of life for individuals with SBS. It's essential to seek medical attention if you experience persistent diarrhea, unexplained weight loss, severe abdominal pain, or signs of dehydration. Early diagnosis and intervention can significantly improve outcomes. If you have undergone surgery involving the removal of a portion of your small intestine, it's crucial to follow up with your healthcare provider regularly. Regular checkups and open communication with your medical team are vital for managing your health. If you're experiencing symptoms that interfere with your daily life, such as fatigue, weakness, or difficulty performing routine activities, discuss these concerns with your doctor. If you notice any changes in your bowel habits, such as increased frequency or severity of diarrhea, or if your stools become bloody or black, seek immediate medical attention. Living with SBS can present unique challenges, but with proper management and support, individuals can lead fulfilling lives. Working closely with a healthcare team is crucial for developing a personalized treatment plan. Support groups and online communities provide valuable resources and emotional support. Maintaining a positive outlook and focusing on self-care are essential for coping with SBS. Advances in medical treatments continue to improve the outlook for individuals with SBS. Living with SBS requires adaptation and resilience, but it doesn't have to limit one's potential.